Morning peeps, happy Tuesday. I just thought I'd do an upload on just a brief one on lung function and my hospital appointments. A question I get asked a lot is what a lung function is, what do you do when you go to hospital, etc. So I just thought I'd briefly run over it. This might help a few, especially on the pages on Facebook that I'm on, the newly diagnosed babies one. I'll post it up on there, just some of my future results and, what it means, what not to worry about, let's go from there. So, obviously we go up to hospital, well, I go up to hospital usually every 3 months. Obviously COVID's changed that, I haven't been up there for a long time, just been doing it all over the phone. Every 3 months for like a checkup, and then obviously an annual review, which is like the big one where you run through lung function, blood test, bone scan, oxygen check, physiotherapy, dietitian, chat with a doctor, mental psychiatrist as well if you feel like you need that. I've never actually done that myself, but a lot of different options when you go up for your annual review. It's like an MOT really, that's what I call it, an MOT for your body. So obviously I go up there, do all the checks, but obviously the lung function is a nemesis, to most people with CF. That's the one that you need to, what I needed to mentally prepare myself for before I went up there. Obviously it's very difficult. I used to get quite anxious about it actually, because obviously the training I was doing, the medication I was taking, all the struggles and the pushes that I put myself through is basically for the 90 seconds of that test, because them two numbers are basically how you judge yourself and how well your lungs are or not performing. So you've got the FEV1, which is the total volume that you can blow out in 1 second, and then the FVC, which is like total lung capacity, really, lung volume. So yeah, it was just, for me, it was more of the mental preparation of going up for my annual review. Like the week leading up to it, I'd be very, very, not anxious, I'd say, but, it would be on my mind, thinking about that one test. So obviously the day I have an annual review, usually I'll be into the gym in the morning or I'll go for a run, make sure that I'm, getting my lungs nice and working and open and free before I go up there. Depending on how I felt, but even if I felt rough, I'd go for a walk or just do something to get my lungs working before I went up there. So obviously I've just got I've written it down here just so people can see. Just bear with me, sorry about that. So I'll just show you this. Obviously, I don't know if you can see that is my basically my results from May 97 at the top there, all the way down to current day really. This is obviously CFstrength here, and I don't know if you can see, but obviously May 97, my FEV1, which is the main number that they look at, I mean that's always been around 50, 60, maybe 70%. Obviously I've had a bit of a jump here, 2001. 2002 is actually the best it's ever been, pre-CFstrength. But as you can see, it's always, and I was always really fit here. I always felt really good. This was like my school days. Obviously, then I left school. I was still playing rugby here. But even when my lung function dipped to sort of 50%, I still didn't actually feel that bad. So it was always quite difficult to tell how my lungs were actually performing. To actually know, what I was going into in hospital. But obviously that was up to sort of January 2017. I went into hospital there, April 2015, when I was really bad. I'll do another video on that. That was probably the toughest time of my life. That was when I went into hospital. And then obviously here you've got CFstrength. Just to give you a bit of perspective of those numbers there, that's over sort of, I don't know, 30-year period really. And obviously I started CFstrength on October the 14th. My lung function was 49/72. Within 4 weeks it hit 91 over 120. So, you know, that is the future of cystic fibrosis right there. You know, I'd struggled for many years to get my lung function. Even if you grab a percent back, you know, you'd feel like you was winning. But so, you know, to all the youngsters, you know, I know you can only have CFtrength in a minute if you're 12 years and above, but I'm sure they might even get that down. And even if they don't, as soon as they hit 12, they can live, you know, a normal, fulfilled life. You've just got to keep battling on to that point, and yeah, make sure you don't give up. That's the key. Always stay positive. Always try and keep on top of it. And I know you have bad days. I'm not saying I'm positive 100% of the time, because I'm not. I just make sure that my positive days far outweigh my negative. And if I'm having a bad day, I just pick myself up, go out for a run. You know, it could always be worse. There's a lot of people in a lot worse position than me. And yeah, so that's it, guys. I hope that's just a bit of information really regarding lung function and things like that. Not to worry too much about the numbers, because like I said, mine fluctuated quite a bit over the years, and I was always feeling pretty good, apart from when I went into hospital in 2016. But I'll do another video on that. So yeah, take care, keep on it, don't worry too much about it. Take care, cheers, bye.